watching your local television network, TSPN. And now back to Today's Seniors Living Well with your host, Laurie Webb.
Hi, everybody. Welcome to back to Today's Seniors Living Well. This is our 7th series, and we're talking about being fit and safe in Amador County, which, judging from all the great resources we have, it's not really a problem to stay fit and safe and active, as we just heard Peach talking about how not being able to drive has not slowed that lady down one bit. 90 years old. I couldn't believe that. So we're going to talk about a health resource that helps us stay safe. We have a wonderful hospital here in Amador County. Sutter Amador Hospital has always been on the cutting edge of best practice things. I served on the board for 10 years, and as a nurse, I was always very impressed with Sutter's approach to things, and that hasn't changed in the 10 years since I've been off the board. My guest today is Kim Diaz. Kim, welcome to the program.
Thank you.
And you are the nurse manager of several really critical departments.
Yes. Critical care, med-surg, and then cardiology.
Wow, so the whole Megillah there.
Right.
Yeah, gosh, just being in charge of med-surg, I would think that would make me crazy.
Yeah, I have helpers. I don't do it alone.
Yeah, no, it's a great staff there. So,
yeah.
So one of the recent programs that Sutter Amador Hospital, and I don't know when they started the SEPSIS program.
Yeah, we started our program in 2009.
2009, so oh my gosh, it's almost 5 years old.
Been 5 years, yeah.
A lot of people don't know what sepsis is.
Yeah.
What is sepsis?
Sepsis is starts out simply, it's a disease that starts out simply as an infection somewhere, anywhere in the body, and your body's defenses take over, and in sepsis, they are kind of overwhelmed, and they go into what I call overdrive. And so what happens is there's a widespread inflammation throughout the body and also clotting throughout the body that eventually leads to organ death, organ failure.
Oh my
gosh.
And
then eventually your own death if you don't have intervention.
Wow.
So unfortunately, a lot of the public don't know about sepsis, know that it's out there, but it has come to the forefront when we find out, more people die of sepsis than colon cancer and breast cancer combined.
Wow.
So it became a medical emergency, and so then in 2009 we started our program.
So it sounds like anybody could be at risk for it. It's not just like the senior citizens.
No, not just senior citizens. Now, very young are at risk, and then over 65 we say is at risk, but anybody that's immunosuppressed, so your organ transplant patients who are taking medication to prevent rejection will also be immunosuppressed. So anybody that's on like steroids, long-term steroid use,
like the people with lung diseases that have to use prednisone,
diabetics are at risk.
People that have like AIDS or other
anybody that's immunosuppressed, or on chemotherapy.
Chemotherapy.
Yeah.
Gosh, we're talking about 80% of the population.
Yeah, a big chunk.
Okay.
Right. Yeah.
So I mean, so somebody gets a bladder infection. When should they know to worry about sepsis?
Great question, because this happens. I hear about people that are have bladder infections, and that's really high risk for older women too.
Oh yeah, all the time.
So you're going to look for things like temperature. So if you don't have a thermometer in your home, it's a good time to buy one. So temperature over 100.4 over 101 is a risk, is a factor. I mean a symptom. Heart rate over 90, so 90 beats a minute is too high, unless that's your norm. And then respiratory rate, so you're breathing faster, you're having trouble breathing, those are signs. We've had people bring in their elderly loved one and saying they're just not themselves. So if you're altered, you're just different, that's a sign. Because organ failure, a brain is an organ, so if you have organ failure, it's confusion. So those are all signs, things you need to be looking for. And if you've recently had surgery, you would want to look for, you'd want to take your temperature,
right?
Because you're at risk,
right? Yeah, that's one of the things that I know as a home health nurse. We instruct all of our knees and hip replacements, and there's a lot of those out there these days
yes.
too. So that's another 15% of the population at risk. That if you have that thing in your body, you need to pay attention to it not getting infected and to please take their temperature.
Absolutely, because I have seen people with recent hip surgeries come in and have a
be septic.
huge, and not survive it.
Yeah.
So,
well, that was quite a alarming cascade you described at the beginning of, your body kind of wanting to help itself but fighting itself.
Right.
Is there any way to prevent that?
Well, stay healthy.
Oh,
That's
okay.
the best way.
Kim says stay healthy. Get your flu shot,
that's
drink
right.
your water, exercise.
Yeah, that's it. That's it. Get your flu shots, your pneumonia vaccines. Hand washing is the best
Yay,
way.
thank you, Kim.
to prevent infections.
Yes.
So that's simple. It doesn't take very long to do that.
It's cheap.
Yeah,
It's
right.
easy to do.
Right. Yeah.
Wash your hands all the time, people.
Very important
Yeah,
stuff. Yeah. Even the nurses have found that out.
And be alert. I guess don't just pass it off as, I shopped too long yesterday, and I have a little bladder infection. But who should they call their physician, or is this a go to the ER kind of thing?
Don't take the time to call your physician. If you want to, if you have a good relationship, they're going to, answer right away, that's fine. But if you have these symptoms, you're at risk, present to the emergency room, because this is a time-sensitive disease. So we have a clock. We're on a clock. So if you present to my emergency room and you tell me your symptoms, so all of our patients are screened when they come through the door. So they're screened, and if they're screened and they screen positive, then the nurse alerts the doctor, and they start the ball rolling, because we have 6 hours. We say we have a 6-hour bundle is what we call it. We have 6 hours to save your life. Okay.
Wow.
It's time sensitive.
So this is almost like somebody coming in presenting with a heart attack.
Absolutely.
Or a stroke, and there's a protocol thing. So there's a protocol thing for this.
There is. There's a evidence-based series of interventions that you can take to start that ball rolling on the path to wellness. So when they present to us, the first thing we do is start fluid resuscitation. So what that means is, depending on your weight, we'll give you enough fluids to resuscitate you, because in sepsis you're very dehydrated. People don't realize that, because sometimes they'll be swollen, but what's in the vascular space is depleted.
So all the fluids are outside.
Yes. Yeah. So fluid resuscitation is number one, and then early antibiotics and restore the oxygenation for your body. Yeah. So those are the steps. We call that a bundle. So we start bundled care, and we continue that. So. And then you probably be transferred to the intensive care unit at that point.
Intensive care at that point. I see.
Yeah.
Okay. And so since you've started this protocol, have you seen decreased mortality?
I'm so glad you asked that question. That's a wonderful
question. That's a big question.
Yeah, so in 2009 we have a sepsis team that meets every week or every month. And we've presented screening throughout the hospital. So no matter where you are in the hospital, we screen. We start the bundle. And what's been nice, and the evidence proves, even within our hospital, that we've done a great job, because our mortality has decreased by over 50% since 2009, because we put this in place. So that, you know what, people always ask me, how do you get your nurses to buy in to this too? Because it's work.
Yeah,
it's
new
work.
stuff. Yeah.
So I say, when they see the results, when they see it actually, the patient getting better in front of them, they buy in. I don't have to sell anything.
Yeah, you don't have to sell anything. So if you've been septic once, are you more prone to get it again?
Yes, absolutely. So if you know, and those would be key words to use when you hit the emergency room door. I've been septic before. I think that's the way it is today. And that will get things going fast.
Rolling.
Yeah, absolutely.
And is this a call 911? I mean, so I wake up and I've got 102 temp, and I just, Howie's like, Laurie, you're not like yourself this morning, and I've had like an infection in my eye or something. Do I call 911 then, or what? How?
So, it all depends on how you feel.
Okay.
I mean, again, it's time sensitive. If you can get to the emergency room quickly, then do that. If you can't, call 911, because what's happening now, what we've done at Amador is partnered. you know, it takes a while for the ambulance to get to our emergency room sometimes.
Yeah, sometimes a pretty long
People
time.
are far out.
Yeah.
So we've partnered, in 2012 we partnered with the local ambulance service. Did some education with them. They're been a wonderful group, just embraced this sepsis care, and they're screening now in the field.
Wow, that's good.
Absolutely. So if you called 911, they would know what to do, right? They're going to screen you in the field. They're going to start fluid resuscitation in the field, and they're going to give us a heads up. So by the time you hit our emergency room door, you know, you might even be better by the time you because of what they're doing in the field today.
Yeah,
so that's really helpful, and that's
great.
even decreased our mortality even more.
Yeah.
Yeah.
Our ambulance company is awesome, I think.
Oh, I really appreciate them. I really appreciate what they've
Just
done.
all the, again, the best practice stuff that they've embraced, and they sent their nurses back to get cardiac stuff. So, and you're over cardiology also.
Right.
So that's probably something that you're aware of, that they did that training.
Yeah.
So besides staying safe and knowing the symptoms, can people help by educating their friends and elderly relatives and neighbors about this?
Yes, and that was actually one of our plans to. So we brought this out to the ambulance service, and now we want to bring it to the community too. So the more the people that know, the better off you are, right?
Oh, that's great.
Tell your friends what the signs and symptoms are. Be aware that sepsis kills people, and the sooner you get treatment, the better. And it doesn't matter where the infection came from. You mentioned bladder.
That's it.
That's very common in elderly women.
Yeah.
But there's also, we had a patient present with cat bite that
another common thing.
Yeah, cat bite. Anything like that. Could be anywhere.
Well, that's really good to know. We got to get you to come to the Commission on Aging meeting and talk about this sometime.
Wonderful.
Kim, we're out of time. Thank you so much for coming in, and we will do our best to educate. So I'm going to end on an up note, because it is See's Candy time at the Senior Center. Well, it's always See's Candy time, but we've got our Christmas stuff, gang, and even if you didn't order, you can still come and buy candy. So come to 229 New York Ranch Road. I'll see you there, because I got to go. We'll be back next week with some more special guests. Thanks for joining us.